Progesterone, you might have heard of it, but what does it actually do? In simple terms, progesterone is a key hormone in the female body. It plays a vital role in the menstrual cycle and pregnancy. Think of it as the balancing force to estrogen, another important hormone. Progesterone is produced mainly in the ovaries, those small but mighty organs. But it's not just about reproduction. Progesterone also impacts other parts of the body, like the brain and bones. Progesterone works like a lock and key. It travels through the bloodstream and attaches to specific receptors in cells. Imagine these receptors as doors. When progesterone, the key, fits into the lock, the receptor, it unlocks changes within the cell. This interaction triggers a cascade of events. These events vary depending on the target organ. For instance, in the uterus, progesterone prepares the lining for a potential pregnancy. It does this by thickening the lining and making it suitable for a fertilized egg to implant. Due to its important role, progesterone is often used as medication. This is especially true when hormone levels are out of balance. One common use is in hormone replacement therapy for women experiencing menopause. Progesterone can help manage uncomfortable symptoms like hot flashes and night sweats. Additionally, it's prescribed for conditions such as irregular periods, endometriosis, and even certain types of cancer. Progesterone comes in different forms, including natural and synthetic versions. Natural progesterone is derived from plants, often yams or soybeans. Synthetic progesterone, on the other hand, is created in a lab. Both types essentially aim to do the same thing, mimic the effects of the body's own progesterone. However, they might have slightly different effects and side effects. Your doctor will recommend the best option based on your specific needs.